pregnancies are getting tougher nowadays. क्या reason है इस changing dynamics का?
So maybe the biology of pregnancy has not changed, Mansi, but surrounding social and family conditions around pregnancy has changed a lot.
She's still walking a
Yes,
journey. She's still
yes.
towards healing.
And this journey is never going to end.
That's
The
true.
challenges of motherhood will change according to the age of the child, but she will be a mother forever.
Forever.
Excessive weight gain or excessive leg swelling, rings tightening, these things, along with headache or blurring of the vision, these symptoms indicate a very high blood pressure in pregnancy.
What is the right biological age to conceive? If you just want to aware people about the right age.
Yeah, it's a very good question, but maybe the answer you might not like because.
Hi everyone, this is Mansi. Today I'm back with another podcast with Dr. Aseemita. So today we'll be talking about pregnancy, a very magical and surprising journey, right, doctor?
Absolutely.
If I start with the questionnaire, first question I have for you is what inspires you to be a gynecologist? What keeps you on your toes always every day?
So, if I look back my journey, I think I always wanted to do something based around women. So, being a woman myself, I always wanted to do something for women and ladies, girls, and adolescent health is one of my favorite always. So, that inspired me when I had the chance to choose a specialty, being a doctor. So, gynecology was my first choice, and I
You
then
must
got
also
it.
feel relatable and connected
Yes.
with.
So, like every story has to be relatable. Even the specialty where you are connected, I think you understand their problems better. Yes.
That's true.
So that inspires me, I think, each and every day to be a gynecologist. And I won't say on my toes always, but making myself available for my
Patience.
friends.
Friends.
Yes, they are my friends. So once upon a time they were patients maybe, but the relationship is forever.
Yeah, it's forever. It's a
Yes.
long relationship.
Long relationship.
And pregnancy being a big part of this whole field of gynecology, what's your view on pregnancy?
So, first of all, pregnancy is, like you said, it's a surprising and a beautiful journey, I can say. But we should not treat pregnant women as patients. There are clients, of course, but they are normal individuals. They are not patients. They are not suffering from any disease. So, if that part we are clear, then we can relate and connect to them in a better way, because they should know few things are normal and expected in this journey, and few things are unexpected or specific to their health, which we can help better if they understand where to seek help and what are things generally happens. So they are not worried, they are not panicked.
One thing I really connected with is they are not patients, it's a journey.
Yeah.
So they're walking a journey. They're just
Yes.
people who are enjoying a different phase of life.
Yes. And probably the most important and the most life changing event of their life, because being a mom is a different thing, but after delivery it's not end of the journey. I think it's the beginning of another important journey, being a parent.
Being a mother, being a
Yes.
parent.
So that also becomes relatable to me, being a woman, that I'm also a mother, I am a wife. So all the roles you expect what that particular woman is going to go through.
Yes. And rightly said by you, this is just a stage of this whole huge journey they are walking towards.
Yes.
And this whole connection you have with them is a long term connection.
Long term. I love when they ask which school to send the child. The child which was delivered by me. After 4-5 years, when they are in the schooling age, they will definitely ask, you suggest doctor what will be the best
For this
school
baby.
and all that thing. So that's how the relationship
That's how
is.
they trust you.
Yes. For every field, they will trust you like a elder sister, as a friend. They will ask your opinion or suggestion, which matters a lot.
And doctor, pregnancy also comes with emotions, which are drastic in pregnancy. It is a journey full of uncertainties, full of surprises. you must also get exposed to so many emotions, be it sometimes hard emotions, sometimes very happy emotions. How
Yes.
do you deal with such emotional roller coaster parents goes
So,
through?
as a medical professional, to some extent, we understand that this
Mm-hmm.
abrupt emotions or the extreme emotions are expected due to the physical and the
Mm-hmm.
emotional and the hormonal changes due to pregnancy. But sometimes we just have to talk to our patients, we have to give time, we have to spend time with them to
Mm-hmm.
understand that everything cannot be similar for every woman. So you have to be a good listener probably. So half of the problem is sorted when you listen to your patient.
Yes.
So
Yeah.
sometimes they just want a let out of their emotions,
Yeah, they
someone is
just want to let it
listening.
out.
So you have to just give time to them and just
And they settle down.
yeah, they settle down. Or you give some choices that
Mm.
whatever you are thinking might not be always right, but maybe you are thinking it too much because of
Yeah.
your health condition right now, so it will get better with time. And
Mm-hmm.
every time you want to talk, I'm always there. So that reassurance, that confidence, if you build in them, then things get settled, because
Yeah.
same changes will not be there after
Mm.
delivery. So
Yeah.
sometimes they are in the extreme of decision making is not possible. They're too much of hassle with the physical
Mm.
changes also, job, everything. So
Multiple things are going
multiple
on.
things going on at the same time on the same individual. So
Mhm.
feeling stressed and confused is a very normal thing.
Yeah. And
So
doctor, coming from this particular answer only, nowadays प्रेगनेंसी थोड़ी टफ भी लगने लगी है. बहुत सारे क्वेरीज और कंसर्न आपके पास आते होंगे.
yes.
प्रेगनेंसीज आर गेटिंग टफर नाउअडेज. क्या रीजन है इस चेंजिंग डायनामिक्स का?
So maybe the biology of pregnancy has not changed, Mansi,
हाँ.
but I think the surrounding social and family conditions around pregnancy has changed a lot,
Yes.
because most of the women are working, they are
Mm-hmm.
ambitious,
Mm-hmm.
educated, so the marriage, the planning for family is also a bit late.
Yeah.
Like we hardly see anyone starting a family in 23, 24 age.
Mm-hmm.
Now our clients are usually above 30 or around 30.
Mm-hmm.
So the some extent the reproductive system also changes. Then moving city to city, managing on their own, like immediate family not
Mm-hmm.
being around, these things also do add, definitely. And another most important aspect is our habits. Like we see women having alcohol and smoking more commonly these days. I don't
Yes.
remember we were seeing so many substance abuse in our
Okay.
medical school days, but now we do see very commonly. So
Mm-hmm.
that also impacts the growth, that also impacts the journey of pregnancy. So these things
Yeah.
make the pregnancy and the journey of pregnancy also tough. That adds
Yeah.
to some medical issues, and that also impacts the
Mm-hmm.
outcome of the pregnancy. So these are few things, the most important being the social change.
Socially everything is changing.
Changing,
People
yes.
are we are also getting
Yeah,
digitalized,
and
more technical.
interculture.
Interculture
mm,
changes.
so pregnancy becomes a more
Mm.
challenge for them because of the different social systems in both the families.
Externally things are
Yes,
changing, that's
externally
why
things,
this
and that impacts the
that
internal
impacts
things.
us.
True.
Yes, अंडरस्टैंडेबल. प्रेगनेंसी का बहुत इंपॉर्टेंट पार्ट कंसेप्शन भी है. जैसे कि आपने बोला भी कि बायोलॉजिकल क्लॉक चेंज नहीं हुआ है, दीज आर दी एक्सटर्नल थिंग्स विच आर
Yes.
चेंजिंग बिकॉज ऑफ विच इट इज बिकमिंग टफर. What is the right biological age to conceive, if you just want to aware people about the right age?
Yeah,
And
it's a very good question,
yeah.
but maybe the answer you might not like, because
Mm-hmm.
the reproductive, the like you said, the biological clock is the same.
Mm-hmm.
So every girl attends menarche, the starting of the menstrual cycle, around 12, 13 years. We all know that.
Yes.
So that means she is reproductively active that time.
Mm-hmm.
Since then, but around 23, 24, these are the time where the peak of the reproductive
Okay.
capacity. But this era we see women getting married around 27, 28, and then want to
Mm-hmm.
settle down in career and then plan for a family around 30, 31,
Mm-hmm.
which is already kind of a decade late.
late stages
Yes.
stage
So
of
it has
pregnancy.
been proved that the number of oocytes and the quality of oocytes, the gametes, in a female decrease with years. That's a
Mhm.
irreversible change. And drastically after 30, and definitely at 40, it is definitely less, not in terms of quantity only, the quality also.
Quality also.
Yes,
Okay.
the aneuploidy incidence is higher in a
Mhm.
advanced age. The chromosomal abnormalities, these things are more
Mhm.
prevalent in the fetus if the mother is above 35. These are all proved things. So that's why
Mhm.
if you ask me an ideal age, so leaving apart other parameters, if I talk about only the biological clock, then 20 to 30 is the best time. After 30,
Okay.
the quality and quantity
उसके
both
बाद there is
goes
a
down.
huge decline in
Yes, it's a
fertility,
sudden decline. Yeah.
sudden decline.
Yes.
Okay. And doctor, usually we see pregnancy as a 9 months journey. हम
Yeah.
लोग 9 महीने की एक जर्नी के
Yes.
जैसे ही जानते हैं.
Yes.
पर डॉक्टर्स बहुत स्पेसिफिकली वीक वाइज भी प्रेगनेंसी को डिवाइड करके देखते हैं.
Yes.
Why is it important? And
Yeah. So for every species of living creatures,
mm-hmm.
the gestation is defined. So for human beings, being the most
Mm-hmm.
advanced creation of God, I can say. So the gestation means from the time
Mm-hmm.
of conception till the
Till
delivery,
the delivery.
that is 280 days. So total 40 weeks. 280
Yes.
days is 40 weeks. So
Mm-hmm.
we are so specific that 7 days in a week, 4 weeks in a month, and
Mm-hmm.
10 months is 20 to 80
This is
days.
how you have
Yes. So we
measured.
calculate from the first day of the last period for the women, and that is the day one of the pregnancy. And from that day onwards, every day counts for the
Mm-hmm.
maturity of the fetus. So that's why we become very, calculative about the weeks, because weeks decides how mature the fetus is. So
Okay.
when the timing of delivery comes, we should not be delivering a baby before its time or
Mm-hmm.
beyond its time. So that's why we
Okay.
are very particular about the calculation, and also it is divided into weeks, and the developmental journey of the fetus is also very specific in specific weeks. So the heartbeat comes in between 6 to 7 weeks. The heart starts functioning
Mm-hmm.
around 18 to 22 weeks. So these are very particular. So then only, if we know this, then only we'll look for that particular thing.
Right timing is
Yes,
important.
very important.
Okay.
So this basically two things: to know the development and to decide for the right time of birth. Both the things are very specific, so that's why
Mm-hmm.
the calculation has to be very precise.
Okay. एंड आर देयर एनी हिडन एस्पेक्ट्स ऑफ प्रेगनेंसी जिसके बारे में अवेयर होना किसी भी कपल के लिए बहुत इम्पोर्टेंट होना चाहिए?
Yeah, few things. I think couples in this era who are educated and conscious about their reproductive career, they should know, like a healthy lifestyle is very important
सुपर
even
इम्पोर्टेंट.
before starting for a pregnancy. So that is a very important aspect of preconceptional counseling these days.
ओके.
And sexual hygiene is one more thing I want to emphasize.
Mm-hmm.
Third thing is a preconceptional supplementation of a folic acid, which will help to prevent any major neural tube defect in the fetus once they
Okay.
conceive. So that is one thing. Some vaccines has to be covered before you plan for a family.
Mm-hmm.
Those we counsel. And weight of the
Mother.
expecting mother
Mm-hmm.
even before pregnancy, if they are careful. Too much of BMI, high BMI and low BMI both
Any
has
extreme
impact.
is bad.
Any extreme
Mm.
is bad. And then in during the journey of pregnancy, the weight gain pattern should be normal. Excess of weight gain in pregnancy has some
Mm-hmm.
complications. Not gaining enough weight also has some impact on the mother and the fetus. So these are some hidden facts, and also having a good hemoglobin backup, these things will make the delivery process and the pregnancy, the oxygenation of the
Mm-hmm.
baby, and after delivery the mother's recovery,
Yes.
everything is impacted by these basic things. So if the couple will know this, then basically our job will be easier.
Yeah. These pointers are very very important,
Yes.
especially after delivery precautions and healing of a mother.
Yes, yes.
जिसको
Post delivery, we should not leave the mother alone. We have to hold her hand and help her to come out of
yeah.
that journey, and help her to become a better parent.
She's still walking a journey.
Yes,
She's still
yes.
towards healing.
And this journey is never going to end.
Yeah, that's
The
true.
challenges of motherhood will change according to the age of the child, but she will be a mother forever.
Forever,
Yes,
forever. It's a huge
yes,
responsibilities.
yeah,
या एंड डॉक्टर प्रेगनेंसी के साथ एक मिस हैपनिंग का भी डर बहुत ज़्यादा जुड़ा होता है.
yeah,
एवरी स्टेप इज़ अ न्यू स्टेप फॉर पेरेंट्स एंड देर इज़ ऑलवेज अ फियर ऑफ what will happen next, कुछ गड़बड़ तो नहीं होगा.
yeah.
आर देयर एनी प्रिकॉशनरी साइंस जो एक्सपेक्टेड पेरेंट्स को पता होने चाहिए so that they can seek help on time?
So, mishap in pregnancy, even as gynecologist, we are also very worried.
Mm-hmm.
So, the best part is the communication between the doctor and the patient has to be very clear that what are the signs or symptoms she should report to
Yes.
according to the importance.
Mm-hmm.
Some things are usual that she should know, and
Mm-hmm.
something unusually, uh, troubling her, then she should definitely let her doctor know. So first thing is trust yourself and trust your doctor when to report, and the communication channel should be very transparent.
Mm-hmm.
And the mishap, what we are more concerned is again week specific. So first trimester we are more bothered and more concerned about any kind of a bleeding in pregnancy, which might be a
Mm-hmm.
earliest sign of a miscarriage or a pregnancy loss. So she should report and we should evaluate, and if everything is fine and there is little bit of bleeding, not
Mm-hmm.
that every bleeding in pregnancy can land up in a miscarriage, but yes, that's an alarming sign. So
Yeah.
we should start some treatment. We should explain
Mm-hmm.
that her behavior and her rest and everything is going to impact the
Mm-hmm.
outcome. So then we can take the call accordingly. Second trimester, excessive discharge or something coming down, dragging kind of a
Okay.
sensation, she should immediately report, because
Mm-hmm.
sometimes very preterm the uterus mouth can start opening and she might land up in a extreme premature birth, which will
Mm-hmm.
compromise the baby also. So that she should report. And uh, too much of leg swelling, severe headache, or excessive weight gain, these things also should be reported so that
Mm-hmm.
we will evaluate accordingly. Excessive
Mm-hmm.
weight gain or excessive leg swelling, rings tightening, these
Okay.
things, along with headache or blurring of the vision, these
Mm-hmm.
symptoms indicate a very high blood pressure in pregnancy. So we should evaluate, treat
Which is
it
a risk for
accordingly. It's a
pregnancy.
big risk.
Mm-hmm.
So she can throw a fit which will impact the baby,
Mm-hmm.
oxygenation, everything. So basically, if nothing to be scared of, but patients should be made aware of the symptoms where they need to tell us, not ignore it.
Yeah.
Extreme vomiting, loose stool, this can dehydrate the mother and indirectly affect the baby. So those things has to be at least informed to the doctor so that the basic things can be done quickly and
Mm-hmm.
managed easily. Nothing is unmanageable, if
Yeah.
known in
If it
time.
is
Yeah,
tackled on time,
tackle.
I think it can be
Yes,
managed.
everything can be managed. Only thing, there should
Transparency.
not be a communication gap between the two.
Transparency with the doctor
Yes,
and
yes. And the
communication
comfort that you can inform anything and
yeah.
everything to the doctor is very important.
Without feeling that कुछ
Yeah,
गलत तो नहीं बोल दूंगी या
am
क्या
I asking a
पूछूंगी.
too silly question?
Yes.
That should not be. If it's a silly question, anyway, your doctor will tell, nothing
Will
to
tell
be
you.
worried.
Yes.
Yes, so that
Mm.
comfort level should be
And
there.
also while having that awareness in you, listening to your body is also
Very
important, that you
important.
have to listen to your
Yes,
body's cues.
yes, yes. Otherwise, some amount of symptoms are expected: little bloatedness, nausea, vomiting in pregnancy,
Mm-hmm.
slow digestion, feeling tired, not feeling very active to get up and start your day.
Mm-hmm.
These things are normal in early pregnancy. So, you should know constipation, these are all
Okay.
common, usual symptoms, and you have to explain that what are the medicines safe if required to be taken,
Okay. Mm-hmm.
because we try and manage it as much as possible with diet, lifestyle change, and increased fiber, all that things.
Mm-hmm.
But if required, if someone is like in need of a medicine, she should not self medicate herself, right?
Yeah.
Doctor has to guide which medicine is the first level of
Nothing
medicine
should
she
be
can.
hidden from the doctor.
Yes, yes. So you have to be open and frank about
Mm-hmm.
your history also, your symptoms also, and
Mm-hmm.
what might have led to these symptoms.
Mm.
So that will lead
Yeah.
to identify the cause and the problem.
And one important information also you have given right now is वीक वाइज एंड ट्राइमेस्टर वाइज भी सिम्टम्स वेरी करते हैं किसी भी
Yes,
मिसहैप के.
yes,
Another question is, very commonly we hear this कि लोगों का बहुत idea, different ideas people have around what kind of delivery a mother should be opting for.
yeah,
Normal delivery जाना चाहिए कि cesarean जाना चाहिए. उसकी surroundings में family, socially, she gets so many opinions.
yeah.
What's your take in this?
So, as a gynecologist, I think we have only two options of delivery, either
Mhm.
abdominal or vaginal.
Mhm.
So, vaginal delivery is called a normal delivery. So, that term itself explains that it's normal, it's the
Mhm.
natural way of birth. But looking at present scenario, there can be a high risk pregnancy, there can be an IVF conception, there can be twins, uh, there might be some medical problem in pregnancy like gestational
Mhm.
diabetes, too big baby, or abnormal presentation. There are some obstetric complication in pregnancy where normal delivery might not be a very feasible idea. So nowadays people do have the right to opt for a cesarean, and as gynecologist we have to do it. But as a obstetrician, if you ask me, everyone who do not need a cesarean directly should
Mhm.
definitely prepare themselves for a natural birth
Mhm.
before pregnancy, throughout pregnancy, and during labor. Then
Okay.
only you'll end up in a smooth natural birth,
Mhm.
and that is the most desirable outcome for the mother and baby both. But if there is too much of medical problems or morbidities, and the mother feels not confident and never has
Yeah.
worked around it for a normal delivery, then just wanting the outcome is not the solution to
Mhm.
anything. You have never exercised, you have excess of weight gain,
Yeah.
you have a medical complication, then it's difficult for an obstetrician also to
Yes. And she cannot we put your life on risk.
yes, no, anyone will want a favorable outcome
Mhm.
for the mother and baby both.
Yes.
We want a safe mother and safe baby always. So any choice of birth should not be at the expense of your safety. That will should be the
Very
motto.
important.
So just trust yourself and trust your doctor and
Mhm.
go with the flow. Many times we do feel that she will end up in a normal delivery, definitely she has really worked hard and she's fit and fine,
Mhm.
and but still ends up in a cesarean. So more
Cesarean.
than the patient, as gynecologist we are also upset that I really thought she will deliver
Yeah.
normally but she didn't. Sometimes we never expect someone, she always has
Mhm.
discussed about a cesarean, and she comes in labor and delivers smoothly. So that becomes a pleasant surprise for us. So
Yeah.
destiny is something else, but I think
Mhm.
mode of delivery should not be at the
Acry-
expense of your
yes.
safety. So anything, whichever mode you deliver, at the end the baby should be safe, you should be safe, and your recovery should be fine.
What's more important is
Yes,
healthy mother and healthy baby,
yes,
and not
that
the
that
type of
should be the
delivery.
motto, not the mode.
Yeah. And doctor, lastly, what message would you like to give to the audience who is hearing this podcast?
Oh, so my message again is to believe in yourself, and of course believe in your doctor. Um, sometimes do analyze yourself on chat gpt or google, that makes our job little easy, but don't go 100% with it. Don't start self treating or self medicating yourself. Talk to your doctor openly. uh, I think she will be better helpful to you.
Very important. And every pregnancy is a different pregnancy. There is
Yes,
no, I don't think there is any comparison between two
no.
pregnancies.
So we do standardize low risk, high risk, and
Mhm.
everything. But even in two low risk pregnancies, the outcome and the journey might be completely different. So everyone is special. Like every child is
Mm.
special. Every pregnant woman and its journey is also as special as anyone. So I don't believe in the term precious pregnancy because I feel every pregnancy is precious.
Precious. Yes.
Yes, and it's the most beautiful journey. I can tell you, being a woman, being a mother myself,
Yeah.
and my message to everyone is to enjoy it.
To enjoy it, to
Yes,
enjoy every bit
enjoy
of
this
it.
journey. Don't make it too hard by thinking too much.
Yeah. Just go with the flow.
Yes, and at regular interval meet your friend who is your gynecologist,
Very
and
important.
talk to her, have a friendly chat, discuss your problems, find a solution, and whichever solution is best for you, I think should work for
Yes.
you. Yes.
Thank you so much for the lovely conversation, doctor.
Thank you. Thank you.
Thank
It's
you.
my pleasure.